Hello my friend, supporter. Welcome to medical science class. As a student of medical science, I wanted to take flavor in the advance of medical science. Shortcut of things said that you that is not it is the real science, that is good or that is not. As a Muslim, I live them only create or accept all our education, last and best messenger Muhammad. Now my friend, the supporter. In case of medical science, those are my patient. Leave me as a doctor, Doctor Sir. Representative of Dr. Mohammed Shurchuri, MSC 007 Shubhashun, Dr. My BMDC registration Bangladesh Medical Limited is 75,995. 75,995. 75995. 75995. Our body is 75,995. Check the Dr. Mohammed Surgery. Still now registration unvalid. When I see now my friend is about how much patient? Those that develop soil virus, those patient. Now soil virus is, if they will be to develop any creation, should have those creations should have life. If David was David and genome, those creations should have genome and they should have chance to David virus develop. If any creation should have genome and in genome there is a bad character and they will be to develop, then develop soil virus. Any virus bacteria convert to soil virus for his or her. Now those are patients. How many patients with question mark correct the soil virus? Ya alif lam lam hai. Yellow shapi yellow mapi yellow kapi. Anar Abdul Mamushul shapi mapi kapi. Now my patient, how much patient by two cut? Ya alif lam lam hai. Yellow shapi yellow mapi yellow kapi. Anar Abdul Mamushul shapi mapi kapi. Now medical science class, we in case of soil virus affected symptom, in case of use symptom like common COVID-19 symptom, use symptom like not COVID-19, sorry, use symptom like HIV patient. HIV patient like symptom, your immunity reduced and any disease, common flu cannot kill, just like that. And also feel pain. If you bad thinking, headache, which organ you do criminalism, that organ pain. If you do, your brain is devil worship, you have headache, just like that. Which organ by you do any criminalism? For example, you do rape, your private organ may be necrose. You do master plan of, it is your mastermind, bad reason. Your heart attack, cardiogenic shock, your master brain of bad reason or ugly reason, like rape, murder, terrorism. You have the neurological shock, cardiogenic shock, neurological shock, just like that, for understanding purpose. Be careful about that. And in case of that symptom, your nail become black, then your eye, if you go to the after sufferer, you try to kill me, beat me, hit me, then your eye become black. And normally your nail become black, you want new nails. If nail become black, you are not want, then go to the hair fall become black, then A to Z transfer to necrose and irreversible cell injury, A to Z cell. And in case of A to Z cell, reversible injury, A to Z cell, and irreversible injury occurs Z to S cell. Just like that, there is the symptom and policy. And those are my patient, and we describe about without kidney how survive, without lung, without heart, we describe elaborated. Without lung, we describe elaborated. No. Without lung, you know that how can survive. In case of, if one lung present, you can survive. If two lungs not present, what happens? What happens? How can patient survive if two lungs not present? If you do not know, your trachea is a blood circulation. Trachea and branches of trachea. By branches of trachea and trachea, you take that root of the trachea and branches, their branches. If remain that, cut the lung and seal that. Then you connect the blood, connect artery to the trachea, more artery to trachea, or more artery to trachea. For example, if you cut the two lungs, oxygen flow reduce. What is the treatment also? Give oxygen. Give oxygen. How to give oxygen? In trachea present, how much? You tidal volume, total lung capacity, tidal volume, residual volume, you try to remind that. How much air remain in trachea? Okay, fine. That air utilize and okay, fine. And tracheal artery remain and oxygen go to the carbon dioxide. In cell come carbon dioxide and lung fuse that carbon dioxide, oxygen. But if your trachea remain, what happen? Trachea remain, what happen? You take the air, from air, oxygen go to the your artery, tracheal artery. And cellular problem, you connect the heart to trachea. Connect the heart artery. For example, arch of aorta, you artery connect the arch of aorta to trachea and superior vena cava to tracheal. Superior vena, there is a vein. Right side you give the artery connection. Left side you give the vein connection from in superior vena cava to a vein connection. Now deoxygenated blood go to the trachea. Now connection. Body deoxygenated blood go to the trachea and trachea oxygen go to the artery. And by that policy, without two lungs, patient can survive. Now you check the oxygen ratio, but take more breath, 16 breath to maybe 24, and maybe 30 when oxygen necessary. Okay, fine. Without lungs, how can patient survive? Then when lung come, artificial lung, or artificial lung use, artificial respiratory machine, there is artificial respiratory machine, but lungs is not present, artificial respiratory machine, how work? How work the artificial respiratory? Then, okay, fine. Endotracheal tube. Then artificial machine, like in case of artificial lung, artery and vein connect to the machine. That machine give to the artery carbon dioxide, take the carbon dioxide, wash out, take the carbon dioxide from artery and give the oxygen other side to artery. Carbon dioxide go to the air or collect the jar, and other jar have oxygen go to the blood. By that policy, patient survive. And artificial heart, artificial brain, artificial kidney, artificial organ, any organ. What organ? In case of artificial organ law, made by atom, you see what is the function of that organ. Artificial organ made by atom. Which artificial organ made by atom? That is just provide the main work. Someone heart, artificial heart, circulate the blood. Artificial lung, refine the blood, or refresh the blood, or take away the blood from blood, take oxygen from blood, take carbon dioxide, give in blood, give oxygen. Just like that, made up of atom, organ, lung, heart, brain, kidney, or other. When artificial kidney, artificial lungs, artificial brain, when brain, heart, in case of organ transplantation is not possible or not, organ is not available in that situation. Then artificial, heart, lung, brain, artificial organ, metabopaton work for that. But when organ available, then transplant the organ. And in case of if lungs is not present, then which lung? You can connect the valid lung, valid animal lung, valid animal lung. You can, for example, hot lungs. In case of size of the lungs, which fit to the body, that valid animal, like goat, sheep, or other, which organ or which valid animal in case of size shape is fit to the chest. That kind of organ, that kind of valid animal suitable for organ transplantation. Valid animal, not unvalid animal. If human is ready, human organ is ready, then human organ. If human organ is not found, then animal organ. In case of animal organ, valid animal organ. Understand? Yes, I think better understand. Thank you very much, my friend and supporter. Today is enough from medical science class.